I'm Cynthia Mulligan at the Moss Park Armory, which is operating as a temporary shelter. Now, the issue of homelessness has been in the forefront in this city since the bitter cold snap began. And advocates, though, say it is just a symptom of a much deeper problem. And today they united their voices to call for action.
My friends are dying, and I'm tired of seeing them die. We need help.
Healthcare workers, advocates, and people who are homeless spoke out at City Hall today, describing life in overcrowded shelters where there aren't enough washrooms, sleep is impossible, and there is no privacy.
I've been homeless now, like I said, off and on for about 3 years. I would rather sleep in a bank machine than go sleep on a mat on a floor beside people that I don't know.
They're calling on all three levels of government to address the root causes of homelessness by providing housing and health care.
We have a crisis of a lack of health care of all sorts, from primary health care, mental health, substance issues, developmental delay, trauma issues.
They want a minimum of 1,000 new shelter beds to be created by April, when the emergency respite centers set up for the winter close down. MP Adam Vaughan says a longer-term solution is the answer.
Hotels and motels that are being used are a form of supportive housing that can be adapted and used immediately, but also adapted over time. I appreciate that on a cold night with very short notice, I'm talking here minutes and hours, not days and weeks, getting somebody in from the cold is the priority because you've got to save their life.
The news conference was held the same day as a monthly memorial for the homeless.
And I've been coming to this memorial for just over 2 years since my brother Brad died and was almost a John Doe, but is...
Advocates from Toronto's safe injection site spoke out today, saying addiction and homelessness are tied together. In the past 2 weeks, they've reversed 14 overdoses. They, too, are calling for better health care and housing.
We know that we need health care that works with and beside people who use drugs, people who are struggling with mental health realities, and people who are struggling with a systemic exclusion.
Now, the Moss Park Armory here was only supposed to be operating as a shelter for 2 weeks. But today, the province and the city asked the federal government to be able to extend that until the end of the month. That's when a provincial property not far from here that used to be a youth detention center should be up and ready to operate as a temporary shelter until April. And coming up, Mayor John Tory last week said he was going to ask the province for an emergency meeting on the case of homelessness. Well, today he had that meeting. I'll tell you what he has to say. I'm Cynthia Mulligan at the Moss Park Armory, where, as I told you a few minutes earlier, a request has been made by the province and the City of Toronto to the federal government to keep it open longer until the end of January as a temporary shelter. That's when a provincial building is expected to be renovated and ready to become a new shelter, and it's not very far from here. In the meantime, advocates for the homeless gathered at City Hall today, uniting their voices, calling for 1,000 more new shelter beds to be created by April. But I spoke with one man who's an advocate today who was once in a refugee camp, and he talked about the conditions here at the shelters in Toronto, and he said that refugee camp actually had better conditions.
I lived in Tanzania in the refugee camp for 2 years. Before I came to Canada, and they have standards. First of all, the crowding that I see here, like when I go to say there's one place right next to us, it's a church, it's one of the emergency ones. You go there, people on the floor, it's like just litter on the floor. There's no heating. People are miserable. You wouldn't put refugees in that situation. It's terrible. Now, most people will tell me, I want to go to Toronto community housing because it is decent, it's affordable. Like I said, if a 69-year-old man comes and tells me that, if I were honest, I'll tell him you'll be dead long before your name comes up. It's a waste of time.
For community housing?
Because it's 7 years waiting list. Waiting time, 7 years. And that's if you're lucky enough to get it.
Now, last week, Mayor John Tory said he was going to ask the province for an emergency meeting to discuss homelessness. Well, that meeting was held today. He met with the provincial ministers for health and housing to talk about affordable housing, creating more spaces, as well as more mental health supports. And he said in a statement he hopes it will, quote, translate very quickly into actions we can take together.